Hi, everybody. Just want to say thank you for being a part of our agency. Thank you for all that you do for us and for your clients. We wouldn't still be in business after 14 years without our caregivers, and we wouldn't have the good reputation that we have without you guys. However, I do think sometimes all of us get a little too comfortable in what we're doing and maybe a little lazy in our work. There's this thing that, well, I'm just going to somebody's home and I'm just helping them out. But what we do is really important. It's important to the person that we care for. It's important to the family members to have confidence in us, that we know what we're doing, that they can trust us, they can trust what we tell them, they can trust what we document. Sometimes too, I think we do get lackadaisical in that, well, there's really no boss there. There's really no one watching what we do. And that's one of the reasons sometimes we do pop in. There was a time I popped into a client's home and found a caregiver in holy jeans and flip-flops because the client wasn't going to report her, so she didn't really think it was an issue. So she was sent home, and she had the choice of not coming back or going home and changing clothes, which is what she did. But we trust you too. We trust you to know what your handbook says. We trust you to do what you say you're going to do. And we trust you to do the things that are on your care plan for your clients. So all of that being said has brought us to the importance of doing this little workshop on documentation. I know some of you are tired of Shelley and I saying you need to document better. You need to document this. You need to document that. So what is the big deal about documenting? Well, we're going to do some reviewing about that, why your documentation is such a big deal. The very least of which is to protect you in the event of a lawsuit. Your documentation can either save your neck and license if you have one and protect you in the event of liability in a lawsuit, or your poor documentation or lack of documentation can hang you in court because you would be liable for a number of things, which could include neglect, abuse, omission or commission of expected duties, just to name a few things. I'm sure you've all heard the saying, if it isn't written down, it didn't happen. But another flip side of that coin is documenting things that you really didn't do. And that is called a falsification of records. It can get you in a whole lot of trouble. Least of all would be families upset. But again, in the court of law, it's a falsification of a legal document and it can cost you your job. For an example, if you check off every ADL on the care plan, but you didn't actually do it, that is a falsification of records. And if you are found liable for any of these things, chances are good the agency will also be found liable because you are sent there on our behalf. So let me just tell you a couple examples of falsification of records that I personally have been involved in. One, I was working on a surgical floor, and the routine there was that the aide would start taking vitals on all the patients while we were in getting report. just something that they could do that would save us nurses a small job. We had paper charts back then, and we had flow sheets that, had AM, PM, you could put the time, and you documented your vitals. Well, I still prefer doing my own vitals because I was the one signing off on them, so I just wrote my vitals in my actual nurse's notes because they were already filled out on the flow sheet. So, wouldn't you think if I went up to a patient and said, I need to take your vitals, that if someone had just done vitals, that they would have said, oh, well, somebody was just here and did that. But I never had that happen. So it kind of caused me to be a little bit suspicious of the aide that we had. Then there was a day that I walked into a patient room and she was unresponsive. So I, did her vitals immediately, called a code. When it was all said and done, there were vitals, quote, normal vitals for this lady already in her chart. I couldn't have been that far behind the aide that I found her unresponsive. And even if her vitals would have been normal when that person took them, the fact that she was unresponsive should have been something that he would have alerted the nurses. And that didn't happen. So I reported my suspicions about the aide maybe kind of making up some vitals and putting them in. And long story short, when this aide was confronted with this, he admitted he was just making up vitals close to the last charted vitals. That was a falsification of records, and it cost him his job. I'll share you another little story with you. The first day that I had my RN license, I was put in charge as the only RN on the floor. I had a gentleman come in with leg pain. That was the complaint. So, I assessed him, I did vitals, called the doctors for orders, and evidently the man had a history of alcoholism, and that seemed to be all they were really cared about. Well, throughout the evening shift, his legs got colder, his toes were turning purple. I kept calling and I kept paging the doctors, and they just blew it off. They wanted me to hang a bag of vitamin-rich solution to maybe help him get through DTs. Well, I stayed in touch with the wife. I documented every phone call. I documented every page, what time they returned, the orders I received. And I can't remember, it's been so long ago now, if they gave me something for paying for him or not. I don't remember. But when I came back to work the next day, he was gone. And so I asked what happened to him and was informed that they had to ship him out because he ended up in surgery that day and lost both legs. Now, there was a lawsuit on the doctors, not on me, because my documentation showed how many times I was calling the doctors, what I was telling them, what they told me, and it was clear that the doctors were not interested in intervening. They were more interested in this gentleman's history of alcoholism being treated than the circulation that was quickly being a problem for his legs. So documentation is important. Principles of documentation, things that you really need to consider when you're documenting. You need to be objective. You need to chart what you saw, heard, or found, not what somebody said or the nurses said in report or the daughter said happened. You only document what you witness or hear. So, for instance, if you walk in the room and your patient is on the floor, you would document patient found on the floor. You don't document patient fell Granted, that probably is what happened, but that is not what you saw happen. You saw the patient on the floor. Be specific. Record dates, times, whoever was involved. What did you do about it? Who did you notify? How long did it last? Like, if they had a seizure or something like that. Where it took place. So for instance, if your patient refuses his AM meds, just document patient refuses to take AM meds and the date and the time. I know on your Access Care, you can document throughout your shift, and I would encourage you each time you make an entry just to put the time. The date's there. Put a time. You need to be clear and consistent. Just the facts. Please use complete sentences and punctuation when you document. Again, we all get lazy with this art of texting, using slang, emojis, abbreviations. But check your spelling, especially if you talk to text, which is okay. You can talk to text your entry, but please check it because AI doesn't know everything. And often it tries to change what you are trying to say. You are professionals. You want to be treated like professionals. You want to be paid like professionals. Then document like a professional. Sometimes we read your notes and it's like we can't figure out where the sentence should have ended and the next one began because they're not incomplete sentences and there is no punctuation in your documentation. Make sure that you document all relevant information. So if your client refuses to take those meds due at 9, besides documenting patient refused to take AM meds, what else are you going to do about it? Often try redirecting, change the subject, try again in a half hour, but document the time and the date that you retried. Often, if you just drop the subject and come back in a half hour, which is still within a legal time frame of giving a medication. If you call us at the office about an issue, document what time you called, which of us that you talked to, what you told us, and what we said. We're accountable too. Did you have to notify a family member about something that happened? Or did you have to call another agency? We have several clients now that are involved in hospice. So sometimes, especially regarding pain medication or changes in their state of health, you might have to call hospice. If that is the case, you need to document who you called, who you talked to, what time you called, what you told them, and what instructions or advice that they gave you. And I know we had that recently with a hospice client that passed away. We had a lot of calls with hospice. Please respect confidentiality. HIPAA is a big deal to the federal government. I know that you get some basic HIPAA information in your educational online programs, but I'm telling you, HIPAA is a big deal. And the government fines, big fines, if they can nail you for a HIPAA violation. So you need to protect your client. There should be no media, no social media that would give away any information regarding your patients. Sometimes we will post pictures, maybe of flowers that we're taking out to clients for the day, but that's all it says. It does not say where we're going, what town, patient name, anything like that, that could give someone an information about our client. So again, there should never be any social media pictures. Yes, we can take pictures of our clients with their permission that you can share with Shelly and Lana and I at the office, and we sometimes share them with the family, and we can post them in their files in the office, but never online. You also need to record errors, things that happen. Family members will appreciate you being honest with them, much more than they will appreciate thinking you're sneaking around. Inform the family and the office, depending on the situation. Let's say you bumped the table and a vase fell and broke. Acknowledge it, notify whoever, document it, and then document what you did about it. Avoid subjective documentation. Patient had a fair night. What does that mean? And what is a fair night to you might be an awful night in somebody else's eyes. So try to avoid those cliches. You know, if you document that they're up 3 or 4 times during the night, that gives us a picture of what their night was like. If they were confused during the night, that gives us a picture of what was going on. You don't have to write good day, great day, bad day, fair day. Those are your interpretation. So we all learned in school when you're talking about things, you need to know the who, what, where, when, and why. So that's kind of the format that I've put this into. So who is the documentation for? Number one, it is for you. It is to protect you from liability resulting from any accusations that might take place regarding abuse, neglect, laziness, a lack of completing tasks or omitting tasks. Accurately recorded facts are the best defense in a court of law. Any and all documentation that relate to the care and the support of an individual can be called for review and used in a court of law. Without documentation, you have no concrete evidence of any services delivered or interventions implemented. And while you may think, oh, I'll never forget this, over time, you do. You will not remember day, time, hour, and all the details of an event. Without documentation supporting your care, the tasks you've completed, the completion of your ADLs, or notifications of appropriate staff, family, agencies involved, you may be seen as ineffective and non-compliant. This can cost you your job. Who else is this for? It's for the agency. We read your notes daily, depending on how crazy our day is, maybe every other day. But we read your notes. Your notes should keep us informed about your client. You are the eyes and the ear for us as an agency and for the family members who depend on you caring for their loved one. Your notes should keep us informed how their day was, what kind of mood they were in, anything new or different in their health. How is their walk, their talk, their appetite? Any changes in the family setting or dynamics, and that's something that you might see that we don't see because you're in the home maybe when somebody calls or a family member shows up or maybe 2 family members show up and then there's a little confrontation. Pain, doctor visits, home health, hospice care visits. If you're there when any of those things happen, please put them in your notes. Your client's compliance with activities such as showering, if it's a day they are expected or a needed shower, taking their medications when you remind them, doing any exercises if they have some to do. Your notes should give us a snapshot picture of everything that happened during your shift that day. Who else is this for? It's for the other caregivers involved in and filling in at this client's home. Good documentation will promote continuity of care. We chose our software company on the features that allow caregivers to read each other's notes. We finally got rid of the old paper notebooks, which so many of them we never got back. You know, the families kept them, the families pitched them, the paramedics took them, and we couldn't track them back down. As well as useful and effective communication, good documentation will help all staff understand the current care needs of the client. and sometimes those needs can change pretty quickly. This in turn promotes continuity of support and care. Documentation can be used to promote or remind staff and family members of specific needs, actions, ADLs, whether they are completed or that they may need completing, reminders of upcoming doctor appointments or family that's coming in for a visit. Maybe you got the laundry started, but you didn't get it finished. If your person relieves you, you can tell them laundry's in the dryer, needs to be finished. But if there is a gap in your shifts, the best thing for you to do is put in your notes, laundry started, ready to be put in the dryer, unable to finish. So the next person, hopefully, coming in reads your notes and knows they need to finish the laundry. In-home personal care develops a care plan for each client, quote, chart, unquote, in Access Care, with information that we feel is important for you guys to know. Each staff member needs to know and understand about the medical history of the client, the interventions that are relevant to their care, and support the needs. The care plan must be read and signed for you prior to your first visit, your first shift with that client. It's really important for you to know about your client when you walk in, so you're not asking us something that you should have known if you read that care plan. The expectations of individuals and their families change. The longer we are involved in the care, the more changes that we will see. Family members' involvement changes, level of required care and assistance changes. Agencies that are involved now may drop out, and like home health may be there when we start, and as the client deteriorates, then maybe home health leaves and maybe hospice comes in. Documentation is for the family. Another reason that we chose Access Care is that the primary family member that is responsible for the client has access to reading your documentation. In this day and age, we have clients who do not have a family member nearby. Family members as far away as California, we've had them in Texas, Kentucky. So those family members, they don't have hands-on knowledge of what is going on with their loved one. They depend on that documentation to keep them abreast of how their loved one is doing. Your documentation notes are not the place to complain about a family member because they will read it. If you have a complaint about someone, something that's going on in the home that you are working at, by all means, you need to let us know. We have a place where we, the agency, can document those issues that the family member does not have access to. The family members have access to the calendar, so they know who is working, what day, what hours. A lot of times the family members call the office just for an update, and we can only relay what information we know from either talking to you or your notes. Documentation is also for insurance purposes. While we are not Medicare and Medicaid providers, we do file long-term care insurance for our family members if they have it. Long-term care insurance has specific things that they are looking for in your documentation that determines whether the care being provided meets their criteria in order for them to pay a long-term care claim. We are required to send a calendar showing the days that somebody worked, the hours, who worked. We have to provide them documentation how much the care is costing them. So in other words, what the caregivers get paid, what the agency gets paid, and we have to send all caregiver documentation. So if your documentation doesn't show that they really need anything, long-term care isn't going to pay for it. Documentation is also for attorneys. We have had to turn over caregiver notes to attorneys. In this particular case that we got called to do that, it wasn't for anything bad. It was more to show the progressive decline in a client and the increased need for care and hours, and then eventually skilled care versus a caregiver companion, which is what we started out with. However, these documentation notes can be subpoenaed for charges of other things like neglect, abuse, a failure to provide services that you're supposed to be providing. So now we know who all is involved in this documentation and who it's for. So what needs to be documented? Let's talk about that for a few minutes. First is the easy things. Checking off your ADL list. Office staff enters ADLs that are appropriate for your client from our assessment and interview with them. If you think of things that you know you do or ought to be added, please let us know and we can do that. Things change with our clients. Things we may start out doing with them may get dropped, and there may be new things come up that, unless you've told us or the family's told us, we don't know should be added. For instance, maybe when we started the case, he or she didn't wear compression hose, but now they do. That is something then that we at the office should add to your ADLs. So please feel free to give us your input regarding your client's plan of care. Just in case some of you are not aware, and I'm not sure how it looks on everybody's phone or tablets, I think they all kind of look different, but the ADLs are categorized as always, as needed, or specific times. So for instance, if we know showers are Tuesdays and Thursdays, that's how we would put it in the ADLs. But I'm not sure that you guys can see the difference in that.